So, as I mentioned, section 1, we're going to cover relevant research, and I'm going to try to get through this a little bit quicker because it's not my research. I've got all the QR codes to the research there. Please go check them out. This one specifically with Dr. Newton is amazing. This is actually to his Instagram. I've got 2 different references. I'll come back to him in a moment. His Instagram has a webinar that he posted a few months ago. It's outstanding. The diagrams he uses to tell you about the technical aspects, the exercise phys base of what is happening in cancer and exercise, or exercise oncology, the field of, is expanding rapidly. What we know about prior to diagnosis, right at diagnosis, through treatment, and after treatment with cancer right now is just jaw-dropping. We've obviously had the inkling because we've seen it. We've seen the testimonials through 20, 30, 40 years of people surviving and thriving through cancer with exercise. But now we're getting down to the molecular base. So myokines, if you haven't heard, exerkins are very small compounds and molecules released while we exercise. About 10 years ago, I think, they started postulating the muscular system as the largest endocrine organ. So now we consider the muscles and the skeleton more than just movement and structure that support our organs, internal organs. They actually produce their own hormones and their own chemicals and create endogenous medicine, cocktails that boost our health, restructure the way our cells are built, the way that our more gross components, our bones and our muscles are functioning. And those myokines just have tremendous effects in cancer patients, both building up resilience prior to chemotherapy or radiation therapy or surgeries, obviously. And then while they're going through it, keeping the immune system functioning high, helping the chemotherapies target solid tumors. We actually improve vascularization in the tumor through, a lot of this is done in a very controlled setting with higher intensity exercise. And I'll get to that in a couple of research studies later. But as we boost that physical capacity of the entire human, we also improve outcomes there at the local tumor site. And then it also will program and improve the capacity of your immune system to attack cells that are becoming metastatic or floating throughout the blood and potentially setting up secondary cancers. So it's just incredible what we've, in the last 10 years, what we've uncovered with exercise and oncology. You can see each one of these research articles will have kind of a base synopsis in the red there, and being physically active, doubling your chance of survival is huge. You have to get the word out to people that just being physically active, just not sitting on the couch, will double your chances of survival. That's a huge increase in probabilities. The challenge trial just posted this year. Is anyone familiar with the challenge trials? They just came out at ASCO a couple months ago. This is something we've been waiting on for the last 8 years technically, because they followed up over 8 years to get these statistics. This was done up in Canada, and it basically looked at what a lot of providers give patients as they go out of their treatment, which is recommendations. Well, we recommend that you XYZ with exercise, but there's no structured guidance for that. Versus a program that stuck with the survivors for 3 years in a structured exercise program, guided program. That made the biggest difference. Both of those, participants who did take on physical activity saw better results in survivorship. But as you can see, those who went through that 3-year program, even after 8 years, they had continued and stuck with it to the point where they were reducing their chance of death, reducing their chance of recurrence, and reducing overall mortality from other chronic diseases. One of the awesome things that I like Dr. Newton from the previous slide talks about is how exercise or your physiology doesn't really know that you have cancer in other parts. And if you go sedentary, like the recommendation recommendations used to be for cancer patients, just rest, just recover. You got to recover from the disease. You can usually, what happens is those who pass away from cancer pass away from secondary chronic illnesses, heart disease primarily, obesity, diabetes, other diseases catch up if you're not moving. So if you're just going sedentary to rest and recover from cancer, it's not doing you any good. So you have to improve your overall chance of staving off death and mortality. And as we know, most cancer populations are going to be, they represent the normal population. In America, Dr. Newton's from Australia. A lot of this research, the challenge studies were done in Canada, and then the UK. Canada, Australia, and UK, they've been producing a whole heck of a lot more of the science-based or the evidence-based for the last 10 years. Back to Dr. Newton's theorization. As he worked with mostly prostate cancer survivors, but now as a professor at Eden Cowan University, he's overseeing a lot of postdoctorate research. And so breast cancer, higher level metastatic cancers, stage 4 cancers, they are actually taking people into the higher intensity training. So we've looked at now various different types of training and what it can do. And essentially, we know that we have to change the metabolic profile of our patients, whether they're coming in at a high fat mass or if they're coming in at a very low muscle mass. It turns out having lower muscle mass is even greater risk of mortality than having high fat mass. So it's very important that we start training people to build their lean body mass, which makes sense. We need them to be mobile, and we want them to be consistently mobile so that their body's getting that endogenous medicine consistently or more frequently. And if they're not strong, that chemotherapy, radiation, all those treatments are going to deplete them further. And so they're not going to be able to be mobile. So we want to start to think about how can we strengthen people right from the point of diagnosis. Today's presentation will be more about survivorship after treatment, but either way, it's kind of like a weight loss journey where we used to teach people you need to do a lot of cardio. We got to get the calories burned. Then we started realizing that if you burn or if you build lean body mass, you're burning calories all day at a higher rate. Very similar thought process for cancer survivors. We have to build lean body mass to set them up for success to be able to fight the disease. As it says, exercise, the message is not don't do your regular treatments. We obviously need you to follow up with the very targeted therapies of chemotherapy and do what we know works best in medicine. But exercise should be prescribed as an adjuvant therapy for all cancer patients. And then if they don't get it during, maybe rehabilitation is appropriate. But certainly after treatments have finished, it's vital, it's essential. I love the way Dr. Newton describes the metabolic profile as a good drugstore versus a bad drugstore. What it ends up playing out as is that the fat mass also has its own, they're called adipokines. The adipokines or adipokines are also signaling molecules that come out from fat that promote a lot of inflammation. So we have to both reduce the drugs coming from the bad drugstore and improve the drugs coming from the good drugstore of our muscles and our skeleton. The OptiTrain trials, these are the ones that really started measuring the effects of different modes of exercise, high intensity with aerobic training and high intensity with resistance training, and comparing the two and seeing what effects or what differences they could notate. And it did show that resistance training had greater effects in multiple categories. The interesting categories are things like improvements in role functioning and symptom burden. Role functioning is how you operate throughout your day. It's your roles that you play in work, at home, with your family, and in your, most importantly, your enjoyable times of life. How can you live up to living a full life? But also cancer-related fatigue, that symptom burden, we're going to talk about it a lot later. It's so important to make sure that people are building up that resilience so that they can maintain some normality in their lifestyles. So after 5 years, we did still see greater results. Even for those people who did fall off the wagon and did continue, they still had greater ability to fight off cancer, to stay healthy, and to live their lives to the fullest that they can. But we also saw that only 35% were tracked after that. So maybe that's a failure in the design of the study, but I think most of us probably know it's hard to stick with it over time. So there's probably some adherence going on there.
I'm going to give you all one more minute.
So this is where we're going to get into a lot of the guts and details of kind of what the recommendations are. I'll probably read a little bit of these because there's a lot of things that I want to cover, and I don't want to lead you down the wrong path. But the most general way to look at this is kind of the way that the American Cancer Society lays things out. What are the goals for physical activity and exercise for a cancer survivor? And that are those are the four that you see there on the left: improving quality of life, reducing fatigue, enhancing physical function, and preventing lymphedema. Is anyone familiar with lymphedema? Yeah. I'm going to go into a little bit of a side tangent and cover lymphedema here real quickly because that could be a whole other 2-hour presentation, honestly. Lymphedema is when the fluids of your lymphatic system start to pool because you have lymph vessels removed. Lymph vessels are removed when you have a biopsy done on a tumor, and they go to the most nearby section of lymphatic vessels to check one of those and see if it is positive for cancer cells as well. That shows that will take you from stage 1 to stage 2. It shows that the cancer is starting to progress through your systems, and that's how cancer spreads through the lymphatic system. So lymphedema happens because we have scarring and, say, a blockage, a barrier in that lymphatic system. And lymphedema, the guidelines for lymphedema, just in my 10 years of working and being certified and continuing my education on cancer, have changed. It used to be a bit of a touchy subject for fitness professionals or exercise professionals because they warned that excessive exercise could exacerbate lymphedema or spark it and create it. And they've changed that recommendation in the last few years. It's now a vital part, an essential part of managing lymphedema. And it's not that heavy or high intensity or repetitive stresses cause lymphedema. It's still just like anything else. It's an appropriate progression over time. You've got to make sure there's increments. And when you progress with someone who's, say, a breast cancer survivor who is wearing compression garments because they're experiencing some of that lymphedema, when you progress, you have to progress in those small increments because if you do see something change, then you can dial it back really quickly. And you just take that as a self-tracking if you're the patient survivor who's undergoing it, but you take it as a very obvious metric as an exercise professional. We, in our program, if someone's had more than, if they're at high risk for lymphedema, which is having more than 5 to 7 lymph nodes removed, anything lower than that, they consider a low risk. Obviously, if they're experiencing lymphedema, we're going to measure them, but even if they're at risk, we measure before and after our exercise routines, just to make sure that something in the class hasn't gone awry. And if we see a change in more than 1 inch in circumference, we refer them straight back to their oncology team. Most of the time nowadays, you can encourage and advocate for your clients to go back to the oncology team and get some physical therapy. If they're at risk for lymphedema, they should be working with a physical therapist. There's lymphatic massage therapists now, which there wasn't 10 years ago when we first started this. So this is a big changing, a big important aspect in cancer care and the continuum of cancer care, but it's changing every day. So certainly, as one of the general guidelines for why we're doing exercise, it's very important that we familiarize ourselves with it and have some risk management strategies for those patients or clients who are going through it. ACSM guidelines. Okay, so ACSM guidelines, I could read off this list and I have them. 150 minutes per week, moderate intensity, 75 minutes per week of vigorous intensity, or a combination of the two. If you're familiar with the ACSM, the American College of Sports Medicine, that's the same thing they give everyone. So essentially they're saying if you're coming out of treatment as a generally healthy adult, aside from the fact you just went through cancer treatments, then you're supposed to achieve what healthy adults are. It's kind of like what survivors experience when they finish treatment, and their support systems, like their family and their work colleagues, are like, all right, you're cured. That's great. Let's go back to everyday life. And survivors don't feel like that's quite their perspective on it. The goal for ACSM's general recommendation is more specifically to meet the client where they're at. Anything beyond what you're currently doing will elicit some kind of health benefit with exercise. So stepping up from 0 minutes in sedentary lifestyle to 10 minutes a day is going to be an improvement, and that's where we have to move with things. We want to make sure that we're not scaring people away or intimidating people with these numbers, and that's what we strive to do pretty meticulously in our program. That's part of that one-on-one consultation that we go through with people before they start. Is reassuring them that there's not going to be it's not going to be too much for them to handle. We're having some audio. Give us a second. Is that better? Yeah? That sounds so loud to me, but it's fine. It's a little loud. But I think it's because we have these guys. Yeah, I don't think we're going to get them to turn it down. I'll just go kick in this door and ask them to be quiet now. Well, I'm sorry. I don't want to shout. I'll try to speak a little quieter here. But so the general idea here is to meet the client where they're at and help them see success. Every single day you have a chance to get people to see success with their fitness. You can find a small challenge and a way to make them want to come back and see you again the next time. And that's the goal, is to build up their frequency, build up their consistency, and build a base for them to eventually be able to go back and take on high-intensity interval training. That's really what my underlying message is today, is that through appropriate programming right after our patients or clients come out of treatment, we can build a very strong base for them to choose what's next, whether it's hiking, biking, or if it's some type of heavier intensity activity. Strength training and resistance training is definitely the gold standard, or the bottom line goal, if we can encourage people to do so. So there are, outside of secondary lymphedema, there are also quite a few other treatment side effects, as you well know. The primary default or way to go about folks having secondary side effects of chemotherapy or radiation therapy or even surgical scarring, immunotherapy, ongoing hormonal therapy, all of these things have effects on their body. If those are too great and they're having pain is that delineation. And that's where we go, pain is for a physical therapist and a doctor. We want to team up with the oncology team if we can. As some of you may have experienced in the past, it's sometimes hard to bridge that gap and to create a cohesive team with our medical care providers. And that just takes a heck of a lot of advocating from us as fitness professionals, being willing to reach out, being willing to go into their offices and speak with them, communicating through your clients. Nothing means more to them, to the doctors, than what their clients are telling them. So if their clients are seeing success, their patients are seeing success, our clients, then have their client go back and share the word, share the testimony with the doctor. Because these side effects are extremely impactful in their quality of life. We have side effects that are, limiting their mobility, from soft tissue scarring and burning from radiation. You have ostomy bags that some people will be dealing with. You have indwelling catheters and chemotherapy ports. And there's a lot of external, if you will, effects on how people are moving, how their fitness is going to go. All of those things you want to be communicating with them. If you've got a breast cancer survivor who has a chemotherapy port right here above their collarbone, and you're working on general fitness patterns, you want to know if that's irritating them. Does it feel superficial, close to the skin that's being irritated, or is it deeper down into the muscles? How are you feeling after that exercise? How are you feeling in the hours after our routine? How are you feeling in the days after our routine? You have to open that door of communication. Communication is so key with working with folks that are experiencing these side effects, because also exercise helps to moderate or eliminate those side effects. In most cases, things like peripheral neuropathy, cancer-related fatigue, these things, exercise is like the main recommendation. It's the main thing that we can do to boost people's well-being and help combat those side effects. We know that some people experience extreme weight loss, even to the point of what we call cachexia. Some people experience weight gain, depending on what kind of hormone therapy they may be on. And so there's various effects on their mobility, their body composition, sarcopenia, not just weight loss, but specifically muscle loss, bone mass loss, osteopenia, osteoporosis. These are all side effects. There's cardiotoxicity, different toxicities that the body goes through. That will And so, with the general guidelines, there are plenty of side effects that we can be aware of, we need to be aware of, but we also want to just keep an open door of communication. If you have clients that are coming through, always ask them for their patience and start slow. I beg people for their patience and I start really slow. Ask for a clear communication, willingness to ask questions and express themselves. That's going to be the best way that you can serve and do justice for your clients. Many contraindications as well. Obviously, comorbidities. If someone's coming in with other chronic diseases, you want to be going through your risk stratification and going back to their healthcare providers and saying, hey, this person is also experiencing AFib, and they just went through chemotherapy, which can be cardiotoxic. Let's communicate as a team. They want to work on their fitness. They're working with our physical rehabilitation possibly, but they want to do a little bit more, and I can help them with that, but I need your recommendations. I need that teamwork and team effort. So many different contraindications, precautions that you can cover. This stuff is all by the books. So email me. I'll send you my notes. I'll send you the slides for today if you'd like. But, for the first section, I think I'm going to move on into the idea of cost and cost effectiveness. Why is this going to work for people? How do we get it to work more frequently? How do we replicate programs that help survivors build up their fitness and their ability to recover faster and take back some control of their health? So obviously, you have expenses related to servicing it. And if you're able to do it virtually, as many rehabilitative practices have taken on recently, the virtual service is going to be a little bit less expensive or cost heavy. There was actually the CORE trial, a test or a study done that examined rehabilitation, cardiac rehabilitation in center. We can tell that this was done in Europe or in Britain because they spelled center R-E at the end instead of E-R. But this was showing that essentially cardiac rehab can be effective and cost effective for patients that are coming out of cancer treatments that are also high risk for cardiovascular disease. But it's not as effective, cost effective as community-based programs. And obviously that's because you're not utilizing the healthcare facilities, you're not utilizing the healthcare professionals. So it's up to our world in the fitness industry to bridge that gap, to step up our level of knowledge base so that we can take these clients through a safe and sound program and build the trust and rapport with the healthcare professionals to build up referral networks and appropriate communication opportunities for those patients. Cost effectiveness, as we have seen, this also came out this year, an analysis of cost effectiveness for chronic diseases. Return on investment of $1.15 to $1.70 for every dollar that's invested in chronic disease or in exercise for chronic illnesses. So it's pretty obvious by the end of these studies, you're going to be able to get your money back, and it comes back even more if you're a healthcare provider or an insurance provider or a healthcare administration. The investment in your patients is just like corporate wellness. If you take care of your people, they're going to produce more. They're going to use those resources less, and the bottom line is actually more profitable if you take care of people. And so this is what we call value of care. We're trying to see a big flip in this. I don't know if any of you listen to the ACSM's partner podcast, The Wellness Paradox with Michael Stack. If you don't, definitely listen to that. Also, the Medical Fitness Association has a podcast that's fantastic, and you'll hear there's big moves being made nationally and big government and with Medicare, Centers for Medicare and Medicaid, to try to get a shift to value of care rather than volume of care. So it is cost effective. It does increase your chances of survival. It does decrease your chance of recurrence. It is clearly going to boost your resilience to toxicities of treatments and side effects thereafter. It improves your physical functioning, obviously, we all know that one. And we know that it enhances your quality of life. So, the next section that we covered here is going to be how do we try to encourage people to step their game up a little bit more than just becoming more active and challenge their physical fitness so that they can receive higher doses and higher frequencies and sit at a base level of higher endogenous medicines flowing through their bodies.